It's long-term what? Hey. Okay, let's get started. This is a photo of my wife and me as our daughter graduated from high school. Proud parents. And we'd been saving for her college education for close to 20 years. We knew what was coming. But when I started this company and saw the cost of a nursing home, I realized I had no idea what might be coming from my care costs in the future. Nursing homes are way more expensive than any college in the US. It's crazy. Today, I'll break down what nursing homes are, how long you might need one, and what they might actually cost so you can be prepared. Plus, a cameo from Will Ferrell. Before I do, let's zoom out. Long-term care isn't a one-size-fits-all. There are lots of different paths you can take. Today, we'll focus on how nursing homes fit into the care journey. So, what is it? A nursing home is kind of like a hospital, just with less doctors and more long-term care. Someone might start out in assisted living and help with things like bathing and dressing. But when they need 24/7 medical care and more support, they may need skilled nursing. That kind of care can happen at home with a live-in nurse or more commonly in a nursing home, which is what we'll focus on today. Let's talk about your odds of needing nursing care. About 25% of us will require nursing care for around 2 years. So a quarter of us will need a nursing home, but usually not for very long. And now the costs. As I mentioned, nursing homes are crazy expensive. The most expensive colleges in the US, think Harvard, Caltech, Penn, Stanford, Duke, cost anywhere between 60 and 80 grand a year. But the average cost of a nursing home, over 125 grand a year. That's nearly twice the cost of the most expensive colleges in the US. Now sure, most people aren't in a nursing home for 4 years like college. But if you're in one for just 2 years, that can be the same total cost as 4 years of some Ivy League schools. Parents spend decades saving for college, but planning for a nursing home usually isn't part of their conversation.
Since the moment our kids were in our arms,
Yeah.
all we talked about was college, college, college.
Yeah.
Have you ever heard anybody ever say, I have to prepare for that?
And as you'd expect, these costs keep rising by roughly 3% a year over the past 2 decades. To save on costs, many people delay entering a nursing home until it's absolutely necessary. And costs vary widely from state to state. For example, a nursing home can cost double in Connecticut compared to Missouri. See the link in the description for a cost calculator in your area. Whoa, the mood just dropped. Let's add a smile with a clip from one of the best college movies of all time, Old School.
We're gonna go to Home Depot. Yeah, buy some wallpaper, maybe get some flooring, stuff like that. Maybe Bed Bath & Beyond, I don't know. I don't know if we'll have enough time.
Now let's talk about your payment options. When it comes to paying for nursing care, you've only got a few options, usually long-term care insurance or just paying out of pocket. Private health insurance and Medicare only cover short-term care, like after an accident, but not long-term care. Medicaid can cover it, but only after you've spent down nearly all of your assets, including what might have been left to your kids. And even then, not all nursing homes accept Medicaid, so your options are limited. Fortunately, long-term care insurance pays for nursing care. So what are nursing homes like? As you might expect, they often feel more like a hospital, less like the home-like setting you might see in an assisted living facility. Over the years, many nursing homes have faced criticism for poor infection control, inadequate staffing, and low wages for certified nursing assistants. We'll dive deeper into all of this on our website. That said, a history of challenges in nursing homes doesn't mean that you're out of options. Many facilities do provide excellent care. You just need to take the time to research and find the one that's right for you. So how do you find a place? Well, as I said, nursing home quality varies considerably, so please research your options before choosing a place. You can use the official Medicare website to find and compare nursing homes in your area, complete with facility ratings. Unfortunately, 2 out of the 3 ratings are self-reported. That's dumb. Imagine if restaurants could self-report their ratings on Yelp. You'd search and say, wow, we have a lot of 5-star Thai restaurants in our area. Fortunately, there are a number of nonprofits that provide unbiased, transparent data on nursing homes, like ProPublica and the Long-Term Care Community Coalition. See the link in the description for more good resources. Online research is a good start, but nothing replaces in-person visits. Visit day and night to seek care during busy and quiet periods. Talk to current residents, family members of current residents, and staff. Check the menu, try the food, review their medical capabilities and the proximity to a hospital. Watch some of the activities. In summary, Planning for nursing care can feel overwhelming, but it's a lot like saving for college. Important, even if it's not on your radar. By including it in your long-term care plan, you're not just looking out for yourself, you're relieving the burden from your family. I'm Jesse, and this is Long-Term What? Where we make long-term care unboring. If this helped, share it with someone who needs it. Your kid, spouse, parents, or friends. Like it so more people see it, and subscribe for more unboring long-term care tips. Watch our next video or podcast, or visit longtermwhat.com. Thanks.